Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Governor Kayode Fayemi asked government workers in the state to get more proficient at working virtually, necessitated by COVID-19. Yobe government records a higher percentage of its vaccination coverage since flag-off of mass vaccination campaign. And UK's Prime Minister Boris Johnson says Britain is experiencing the fastest growth in cases amid increasing pressure on health services. Welcome to the program. The director of the Africa Centers for Disease Control and Prevention, Africa CDC, Dr. John Nkegasson, says he is encouraged by the way South Africa has handled its latest COVID wave, adding that severe lockdowns were no longer a tool to contain the virus. Speaking at a news conference on Thursday, Africa's top public health official said we should actually be looking at how we use public health and social measures more carefully and in a balanced way as the vaccination increases. Last week, South Africa lifted overnight curfew rules as officials said the country may have passed the peak of its fourth wave of infections. In the meantime, Nigeria recorded additional 5 deaths due to COVID-19 complications. The NCDC in its update confirmed 856 new cases, putting the total number of cases at 245,404. According to the agency, the COVID-19 virus can live on the surface for several hours. It's asking everyone to take responsibility.
856 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 19 states and the FCT, indicating an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 337 infections, Kaduna had 152, FCT 87, Gombe 47, Delta 43, while Kano registered 31 cases. Kwara registered 27 cases, Enugu 26, Nasarawa 19, Niger 15, while Oyo and River State 11 cases each. Other states including Benue, Bauchi, Ogun, Borno, Ekiti, Edo, Plateau, and Bayelsa states logged a single-digit infection. The total confirmed cases in Nigeria now stands at 245,404. The report also includes a backlog of confirmed cases from Lagos, Kaduna, Enugu, Kano, Niger, Benue, and Borno states, as well as 0 cases from Ondo, Osun, and Sokoto states. 433 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 217,247. There were 5 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,058. Currently, there are over 25,000 active cases in Nigeria, while more than 3.8 million samples have been tested so far. Almost 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.1% of the population have been fully vaccinated. The total global confirmed cases have surpassed 297 million, while deaths are beyond 5.4 million.
The governor of Ekiti State, Dr. Kayode Fayemi, has asked workers in the state to get more proficient at working virtually as COVID-19 has necessitated a new normal. The governor, during his New Year visit to the state secretariat, recalls the challenges posed and changes engendered by the pandemic last year, calling on workers to be mindful of emerging variants. He says his administration is working more on equipping government offices with facilities to enhance physical distancing and relevant decongestion.
All our executive council meetings are being held virtually. We still meet every week, but we meet virtually because we now have a new variant of COVID-19, which is even mutating faster than the previous variants that we've had. So spending too much time physically within the same space is not the most advisable. But in that adversity, there's opportunity. Many of our people would learn to work virtually and to work a lot more away from their physical space in a way that protects their well-being and healthcare. So I'm delighted to come, as I normally do, and to felicitate with our workers and wish them well for the new year.
And as Nigeria continues to drum up support for local production of vaccines against coronavirus, the Oyo State government says it would not relent in increasing awareness for protocols against the virus. The Executive Secretary of Oyo State Primary Healthcare Board, in an interview with Channels Television, says aggressive vaccination drive is on to ensure better coverage of residents in the state.
Initially, when we started, there was a kind of misgiving and law in acceptance of the vaccination exercise. But with consistency in our education creation, awareness creation, and information dissemination, demystifying the myth and misconception that people were having, we were able to win the confidence of the masses. Initially, we were actually going to them and pleading with them to come and take the vaccination. But now people are actually coming forward to take the vaccination exercise, and it has been so much impressive. As a date, in Oyo State, we've been able to vaccinate for the first dose more than 584,000. And for those that actually come for their second dose, they are above 219,000 individuals that have come forward. Then, after doing this mass vaccination campaign exercise, we've been able to now, because the countries has commenced the giving of booster doses. So with the booster doses, those that have completed the first and second dose, and has an interval of about 6 months in between the second dose, and now can actually benefit from the booster dose. So as at date, we've got about 1,090 individuals.
And 4 weeks after Yobe State government flagged off the COVID-19 mass vaccination across the state, it has now achieved about 4.1% vaccination of its eligible population during the period under review. The Executive Secretary of the State Primary Healthcare Management Agency, in an exclusive interview with Channels Television, reveals it would soon achieve its set target of 50%.
For us to achieve herd immunity, at least 50% of the population should be vaccinated, preferably by the end of 2021 or at most by the end of January 2022. Based on that, the National Primary Healthcare Development Agency would support and guidance of the Presidential Task Force on COVID-19 suggested that all states should strive towards ramping up the COVID-19 vaccination by embarking on mass vaccination campaigns. As at the time that His Excellency flagged off the mass vaccination campaign, we had only 0.31% coverage of the population. As at yesterday, we have coverage of 4.15, which means it is more than 10 times what we have been able to vaccinate previously within this time. However, it is still a far cry from where we want to be. We want to vaccinate 50%. We are still at 4.something%. It's still not good enough.
Well, according to our World in data on vaccinations, 9.21 billion COVID-19 vaccine doses have been administered worldwide, while 3.88 billion have been fully vaccinated. That's about 49.8% of the world's population. Now, of that figure, Nigeria has administered about 14.8 million doses and 4.48 million fully vaccinated. That's about 2.2% of the country's population. We want to talk more about this. Joining us, Dr. Yohe Akase, infectious diseases physician with the Lagos University Teaching Hospital, Luke. He joins us for more on the program. Welcome to the program.
Thank you very much for having me.
Let's talk vaccination drive in Nigeria. What's your observation?
Yeah, I think like we've heard from the various states, I think the response has been impressive. If you put into perspective the amount of hesitance that we had, in the past. Over the past few weeks, we've seen, a lot of people have come up to take both first dose, second dose, and even a reasonable amount of people have also come for their booster doses. What is concerning, though, is these figures, as we're saying, an increase in figures. What is significant amount of it is made up of people who actually didn't get vaccinated, or who by some way still got their hands registered as being vaccinated. So I think it is something that is a big problem, and that so the numbers are quite very good, but quite a significant number of people among those numbers got those cards, are registered as vaccinated, but have not actually received the jab. So it's something that while we're happy with the numbers, really it's something that we should be concerned about. That yes, the numbers may look good, but we have people who have not received the jab, but who have been recorded as being vaccinated. Yeah.
So, as much as you've observed that, there's also the case of people who say they attended or visited vaccination sites and there's a whole crowd. And so going back, some of them are also discouraged. In such situation, what would you advise?
Yeah, so I think that's where there is need for government. That's sort of shortcoming of doing, mass vaccinations. Logistic challenges, will come up. What the government needs to watch out for, though, is whether you have staff who are creating artificial delays so people can accept the shortcut, and get on with it. It's a responsibility of the primary healthcare boards at various states to make sure that it's easy for people to come in. They will arrange logistic, the logistic such a way that people come and get their jobs, and go home. Creating, crowds at vaccination site defeat the purpose. Number one, it's an easy area where people get exposed to one another and get infected and take that away. So it's the responsibility of primary healthcare boards, at various states and even at local government levels to schedule these things better. We see crowds of people coming around vaccinators trying to get registered, because that the model we're using in the country requires people first to be registered online, and that their records to reflect online before they actually go for the job. And I think that's where most of the delays occur. So I think it's the responsibility of the primary care board to make sure that this process is more seamless and people will spend less time, getting vaccinated. What they do need to look out for, like I said, is to make sure that people are not creating artificial, queues, at this site, so that people can, accept the shortcuts and, go on with it. Because, like I said, I mean, if the numbers keep going up, but that particular avenue of people easily having access to shortcuts, where they don't get a job or get a cars and walk away, that will seriously. And we've seen instances where people went elsewhere, they were, checked for evidence of antibodies against the vaccine, and there was none. So really, this is something, in as much as we're happy with the numbers, and I think the primary healthcare board has done a lot of work in working with people to overcome their hesitancy, their concerns and their fears, they do not need to, now put on modalities in place to reduce the number of people who are bad. We saw this with yellow fever. We've seen this as well when people require documentation for travel. We've seen that people can, try and, bypass that process, but it surely shows you the amount of work they need to do.
It also speaks to, people not also being convinced of the vaccine. I mean, just in his New Year message, the Lagos State governor was appealing to residents to get vaccinated. In other parts of the country, we've seen state governors, the other public servants taking the jabs, the booster for everyone to see. Do you think that drive, that technique has worked, made people want to take the vaccines, trust the vaccines enough to take them?
Yeah, so I think, we have to employ a multimodal approach, so that definitely is one way to go, while we keep explaining to people, on a day-to-day basis, the benefits of that. And I think getting more public, people. And I think one thing that has, countered a lot, especially caused a lot of resistance at the beginning, were public figures who came out publicly, to question, the motive or the benefits and, support all other forms of, conspiracy theories that really did play, a huge role in terms of discouraging people. So that's one, that public, support for that. Also, I think, it's clear that there are some people who, by virtue of their office, feel obliged to come out in public and say something. But these are people that have clinics and people who know them and who maybe in private say, well, you know what, I don't believe. So I think, we have to keep employing, many modalities on, encouraging people, to come and get vaccinated. And, public officials coming out to publicly do this is one way, while the public health authorities keep telling people that, you know what, COVID is here to stay. If you don't get vaccinated now, or you escape in, but you're getting infected in 2020, you escaped in 2021. COVID is here, 2022, it's there, 2023, it will get, so eventually everybody will get exposed to COVID. And if you didn't get vaccinated, or you're not going to get vaccinated on a rolling basis, it's going to eventually meet up with everyone. Now, it's clear, it's evidence for now seems to suggest that we may be receiving vaccines on a rolling basis. So people who missed their first 2 doses, I have evidence to show that we're vaccinated. When it's time to get a booster, they may go and get a booster, but everybody knows that the protection is not going to be good enough.
We appreciate your time. Thank you so much, Dr. Ihohia Kase, an infectious diseases physician with Luth. Thank you so much for joining us on the program.
Thank you. Thank you. Yeah.
Well, still to come, the highly mutated variant Omicron is still attacking the vaccinated and unvaccinated Americans. We have more on that story when we return. Welcome back. COVID-19 is on a war path in the U.S. after more than 1 million people were diagnosed with COVID-19 in the U.S. in a single day as a tsunami of Omicron swamped every aspect of daily life. The highly mutated variant is set to be attacking vaccinated and unvaccinated Americans. Our Washington correspondent Maria Bird has more.
The U.S. is faced with more than 1 million COVID cases and a major surge in hospitalizations. One of the top infectious disease doctors in the U.S., Anthony Fauci, believes that the Omicron variant is a major threat.
Even if you have a less of a percentage of severity, when you have multifold more people getting infected, the net amount is you're still going to get a lot of people that are going to be needing hospitalization. And that's the reason why we're concerned about stressing and straining the hospital system.
The spread of the Omicron variant has caused an inability for schools across the country to fully reopen. But government officials are determined to beat COVID-19.
Working with our local officials to keep kids in schools, I commended Monroe County, the city of Rochester, were doing the right thing, protecting our kids, but also knowing that part of their health is their emotional health. And that emotional health took a huge hit. We don't need any more studies to see that. You see it in the eyes of parents who say, my child is not the same as they were before this pandemic. That year of isolation, detachment, not real learning. And so we are excited about having more test kits available. We've had 5.2 million test kits delivered to schools already with the express purpose of keeping kids in school or having.
One of the measures being used to combat the virus is increasing the access to testing.
I want New Yorkers to embrace the concept of empowering them, of saying you can do this right at home. So we want to further expand the 1.5 million tests that we receive from the city and from the 1.6 actually from the city and from the governor, who was an amazing partner. I want to get take-home tests in the hands of people.
The new year has not come without its challenges, but it has sparked a new commitment for government officials to keep the government, schools, and businesses open despite the surge of COVID-19. From Washington, Maria Bird, Channel Television News.
And from the US to the UK, where Prime Minister Boris Johnson has called out anti-vaxxers for putting mumbo-jumbo on social media. He told broadcasters this was the first time he was speaking out with them who he called spouting complete nonsense about COVID vaccines. He estimates that about 30% to 40% of people being treated for COVID in hospital have not been vaccinated at all, as he calls on them to get jabbed. Well, our London correspondent, Juliana Lanka, is with us now. Hi, Juliana. It's good to see you in the new year. It seems it's still voluntary rather than compulsory to take the COVID vaccines in the UK, isn't it?
Yeah, good evening, Millicent. Happy New Year to you. Lovely to see you too. It isn't compulsory to take your vaccination in the UK, but we're almost getting that way. I think what's happening in Melbourne with Novak Djokovic has really put the kind of anti-vaxxer or the non-vaccine community in the spotlight once again. And you're right, earlier today, Prime Minister Boris Johnson was speaking out about the usual rounds that we're seeing on social media, including WhatsApp, particularly within the Black community, who have been, pointed out, or should I say, isolated in the House of Commons as being one of the largest minority communities in the UK who have refused to take a vaccine. So far, about 60% of the population, so about 34 million people, have taken a booster jab or the third vaccine dose here in Britain, which is pretty good because we know that one of the ways Britain is fighting itself out of the COVID crisis is through the vaccine. So to answer your question very short, no, it's not compulsory, but I think the kind of morale message for people living in Britain is that you must take it.
We understand testing rules travelling into the UK has also been altered. What's the latest? Testing, isolation before and after travel?
Well, yeah, so yesterday during Prime Minister's questions in the House of Commons, Prime Minister Boris Johnson did announce that from Friday, the rules for travelling into England are going to be much simpler, much to the relief of beleaguered travel bosses who have actually written several open letters to the Transport Minister, Grant Shapps, as well as the government, saying that their recovery was hampered by these pretty high COVID test kits. So before now or before tomorrow, anybody travelling into England would have to take a COVID test 2 days, within 2 days of travelling. Once you get to the UK, you would have to isolate until a PCR test comes back negative. Now, because we know that Omicron is now the dominant strain of COVID in the UK, some figures were up to 200,000 earlier this week. Travel bosses, as well as ministers, also deemed that these measures were no longer fit for purpose. So they're going to be scrapped on Friday. But if you are not fully vaccinated, you still have to isolate for 10 days if you come into the UK, take a PCR test on day 2 and take a PCR test on day 8. So I think the big news out of this really is that PCR tests for fully vaccinated individuals will now be replaced with lateral flow tests or antigen tests that were deemed not as accurate as the PCR test. But now you can take a test within 30 minutes and that result is seen as good enough for ministers here in the UK.
All right. Thanks a lot, Juliana Lainka, our London correspondent there. Many thanks.
Thanks.
A total of 125 passengers who arrived in the northern Indian city of Amritsar on a chartered flight from Italy have tested positive for COVID-19. They were among 179 passengers on the flight from Milan, which landed in Amritsar Wednesday afternoon. India reported more than 90,000 cases. This is a nearly six-fold rise over the past week that experts say is fueled by the Omicron variant. Here's more of the global update.
Latest government figures show a total of 17,276 people were in hospital in the UK with COVID-19 as of January the 4th, the highest number since February 19th, 2021.
Grateful, Mr. Speaker, and I think that
Prime Minister Boris Johnson says the country is seeing its fastest growth in cases as more than 20 hospital trusts declared a critical incident. And over in Israel, data supports growing evidence worldwide that Omicron causes milder illness than previous variants of the coronavirus, even as the country grapples with a record number of daily infections. Nonetheless, health officials are concerned that even if Omicron is less harmful, its fast surge could overload healthcare systems.
What we're seeing in Israel is very rapid spreading of the virus, mostly the Omicron variant. And as a consequence, at Hadassah, we're now seeing a rapid increase in hospitalization. Now, it seems that the virus is not as violent or virulent as the previous versions, but considering the rapid spreading, we see an increasing rate of hospitalizations. We already opened one ward, it is full, and today at Hadassah we're opening the second ward.
The director of the Africa Centers for Disease Control and Prevention says he fears that COVID-19 could become endemic on the continent, given the slow pace of vaccination.
Unless and until by the end of this year, the continent actually scale up its vaccination to above 70 or 80%, my worry is that we might actually be at the end of this year into a scenario where COVID becomes endemic.
Dr. John Nkengasong also says that severe lockdowns are no longer the best way to contain COVID-19, praising South Africa for adopting that approach recently.
We are very encouraged with what we saw in South Africa during this period, where they look at the data in terms of severity, and they actually did what we are encouraging countries to do, to really say that the period where we were using lockdown as a tool, severe lockdown as a tool, is over. We should actually be looking at how we use public health and social measures more carefully and in a balanced way as the vaccination increases.
At least 125 passengers on an international flight from Italy have tested positive for COVID-19 on arrival in India. All passengers have been asked to undergo institutional isolation. Meanwhile, India reported 90,928 new daily COVID-19 cases over the past 24 hours, up nearly fourfold since the start of the year. And finally, France's parliament has approved President Emmanuel Macron's plans for a vaccine pass to help curb the spread of the Omicron variant. People in France have for several months had to show either proof of vaccination or a negative COVID-19 test to enter venues such as cinemas and cafes and use trains. But with Delta and Omicron variant infections surging, the government decided to drop the test option in the new bill. The vaccine pass rules will apply to over 16s and not over 12, as the government had initially sought.
Our website, channeltv.com, has more updates and a better understanding of the pandemic, plus other stories at your fingertips. It's channeltv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.